Good afternoon, everyone. We're excited to have you here for this next spotlight discussion on Politico's Healthcare Summit. My name is Mary Eccles, and I'm a health reporter here at Politico. So this session is going to focus on Europe's Beating Cancer Plan, the first cancer action plan in 30 years. And it's Europe's attempt to head off a projected 24% increase in cancer deaths by 2035, which would make the disease the leading killer in the EU. What that means in practice, or at least it should do anyway, is a series of measures coming out of the Commission aimed at tackling tobacco, front-of-package labelling, boosting vaccination rates, and health data sharing, amongst many more things. And just to make it clear, this was more than just a kind of DG Santé baby. The Commission President, Ursula von der Leyen, made cancer a key focus of her first mandate and actually made it a very personal issue, talking quite movingly at times about her own family connections as motivation for studying medicine. So when I spoke with my colleagues about this, who'd covered it at the time, they said as well that the plan's consultation back in 2019 was a really large event at the European Parliament. You know, there were choirs, there were speeches from the president. It was a big extravaganza. And so several years later, I'm now asking myself, and the panel will dig into the implementation of the plan, the gaps, because as I said, many things were promised, not all achieved just yet. And we'll also be looking at the future for cancer policy in the coming years in Europe. So I'd like to remind everyone watching online or in the room to talk about the summit on social media using our hashtag #PoliticoHealthcare. And I'd now like to welcome our 5 speakers. So we have with us here from the far side, Olivier Nataf, the Global Head of Oncology at the French pharmaceutical group Sanofi. Pernilla Gunther, a member of the European Commission's Cancer Mission Board, the expert group which helped come up with some of the recommendations for the Beating Cancer Initiative. We also have with us MEP Nicolas Gonzalez-Canzares, a MEP from Spain for the Socialist and Democrats group, who worked as shadow rapporteur of the Europe's Beating Cancer Plan, and who also has practical experience in the health sector, having worked as a nurse. Also joining here on this very long panel is Antonella Cardone, the Chief Executive Officer of Cancer Patients Europe. And then last but not least, we have Wendy Yared, the Director of the Association of European Cancer Leagues, which represents more than 30 national and regional cancer societies across Europe. So thank you very much for joining us. As I said, the title of this panel is Beating Cancer Plan, Implementation and Gaps. So in order to kind of ascertain how well the implementation of the plan is going, I thought it would be useful to kick off one by one with each of you giving a mark out of 10 for how successful it's been so far, and maybe give one short sentence explaining where those gaps might be or what you'd like to see. Very, uncontrived structure, like all reporters. So perhaps we can kick off with you, Wendy. How would you rate it so far out of 10?
Thank you very much for this invitation, Mary, and I'm very pleased to be able to say something around the Europe's Beating Cancer Plan, because now it's been in existence, and now we're coming into the new legislature, so there was a lot of nervousness, are we going to continue implementing the Europe's Beating Cancer Plan, because as you said, not everything has been implemented. I would give it, right now, where we are standing, or sitting, 6.5. Okay. Because there remains a lot to be done. We welcomed it, all the cancer leagues, we really welcomed the Beating Cancer Plan when it came, because, as you said, nothing had been done for 30 years. And so we were very pleased to see it. And I think, and what we saw, though, we saw that the Beating Cancer Plan was really ambitious. If you see some of the goals, for example, one of the goals is that for every citizen to know what is the European Code Against Cancer, 80% of them to know by next year, 2025. The last survey we did, the highest percentage was less than 20%. So how are we going to do that? So that's really an ambitious goal. So let me just go to the gaps. So while a lot of it has been implemented and is still going well, the gaps we see are right now, we failed to update the tobacco control legislation, especially as planned, especially regarding new tobacco products, and also regarding smoke-free environments, especially for youth. there are aims and there are goals, but we need to also see more about the implementation. There's nothing around the implementation. And then also the right to be forgotten, that's already listed in the Beating Cancer Plan. And the goal was that last year we should have a code of conduct. ECL, European Cancer Leagues, we were part of the discussions around the table with industry, with insurers, and there was no code of conduct that could be agreed to. So that is where we are. So that's why 6.5, and we're hoping that that will continue. But I will stop now so that others can speak.
Thank you. Antonello, how would you give it out of 10?
Well, for us, as for the European Cancer Leagues, for the patients, the Europe's Beating Cancer Plan was welcomed as a very innovative and crucial. It was a very, very good plan when it was launched. I used to say it's a nice piece of paper because when it was launched, it was really very nice. But then now when it comes to the implementation, we have seen a lot happening, yes, a lot of attention that was given to cancer. But one item of the cancer plan that has been very close to our heart was the overcoming or addressing inequalities in all aspects, from the prevention to treatment and then survivorship. We don't see a lot of those inequality gaps closing down. There was a recent, a few months ago, there was a report launched by OECD and the European Commission looking specifically on the inequalities after the launch of Europe's Beating Cancer Plan, specifically on prevention. And still, there is the inequalities are there and have not been overcome as much as we would have liked, both in prevention and in treatment. Because also if we look at treatment, the still access to innovative treatments varies tremendously from one country to another. And of course, for cancer, access to treatment means surviving or dying. So it's for us, this is something that still needs to be addressed into the implementation of the plan. So this is why we should not stop implementing Europe's Beating Cancer Plan, because there is still a lot that needs to be done in terms of closing the gaps in between countries.
And would you give it then higher or lower than Wendy at 6.5 in terms of implementation? How successful would you say the implementation is?
I would say 6.
Okay.
From the patient perspective, we really would like to see more done.
What about you, Nico?
I have to say first that it was a beautiful piece of paper, but also a big one. I mean, it was very hard to deal with that. And I think the beating cancer was a very important work in the Parliament, also in the Commission. But it's true that we need to implement a lot of things that are still undone. First, I want to mention one, regarding prevention. The first step to fight against cancer is prevention. And we are lagging very much behind in Europe regarding the prevention about tobacco and new tobacco products. We have to know that the Commission is very slow in updating the new legislation in this reform that is needed, and we call so many times. And this is one of the examples that we have to go faster, because we have an objective that was a free tobacco generation by 2040. It's almost impossible right now. We don't move towards a new legislation, for example, against new products and tobacco and new taxes and new warnings and so on. First, we need also more coordination among member states, because there are different initiatives, but sometimes we really don't know if are very, very good aligned with the beating cancer ideas. And let me mention one thing regarding implementation. You mentioned previously the right to be forgotten. I worked very hard in the right to be forgotten. And as an MEP from Spain, I also put in contact with my government and asked them to implement that. And it was implemented. So I think that we have to use also our connections in order to gain a space for the beating cancer proposals. Go for that and do it. And finally, I want to mention that we are lacking of funding. We cannot always remove for the money of health at European level and go to other directions. We have to be strong defending European money for cancer. I think the Horizon Europe is well funded, but we need more also in research and development. And I don't want to criticize Commission, but they're being very slow in some things. There are other things that, many things that should be implemented by member states regarding comprehensive centers, other research and developments. I think that it's time also for member states to ensure that we can reduce the inequalities that was mentioned, because one of the main outcomes of the Becker report in the Parliament was the differences between people in the access to treatments, in the access to prevention, in the access to early detection.
So, in terms of numbers, how would you rate it?
In terms of numbers?
Yeah, we got a 6.5, a 6. It sounds like we're descending.
I don't want to say numbers.
Diplomatic. Pernilla, what about
I
you?
have to say that we must ensure that we continue working on that.
Okay.
Beating cancer was a wonderful idea, but we have to implement this idea again and again and check and assess and again.
Pernilla, yeah, how would you rate the success of the implementation so far?
Should I start with the rating?
Yeah, go ahead.
I think an 8, maybe.
Okay.
Yeah. Yeah, because I actually believe, maybe I stick my nose out like a Pinocchio here, but I'm not lying. Because I think the Europe's Beating Cancer Plan actually is a success. And why? Because it has also been a great deal of funding according to the Europe's Beating Cancer Plan. And that's for the first time, I think, where something in healthcare, when research actually has been funded in that way. And you say more money, I would say that take care of the money there is. Because there are so many member states still who have not been involved in, connecting with others, to partner with other research centers or companies together with patient organizations and so on. And since I'm traveling around as an ambassador for the Cancer Mission Board, I see a lot of what's happening in Europe. And I can see, actually, that this is working, but in very many different ways. In some countries, the professionals are really eager to get a national also cancer plan and work according to Europe's Beating Cancer Plan, but the government is not interested in at all, and they get no support. But in other cases, we can see very eager research centers or societies of all kinds, patient representatives, who really, really would like to have all these projects going together and apply for this funding that still is available within the Horizon program. So maybe I even rate it higher, 8.5. Yeah.
Okay. And Olivier, would you give it?
Yourself.
No, but I see so many examples.
For me, for the average, the final average.
Exactly.
Okay, I'll come back to you. And Olivier, what about yourself? Would you give it 8.5
I see that
or
you
9?
like numbers, so I'm going to start with this, right? And I'm going to give you a weighted average, right, to do some diplomacy. So I guess that the intention is clearly an 8, right? And the implementation is probably a 4 that gives us a 6. Right, on weighted average. But it's clear that it has the merit of existing and focusing on many of the right things, whether it is research, health data, inequalities, and also the coordination of centers, which is all good intent and all the right policies to move forward. But then if I focus again on research, for example, we can give a couple of examples of where we could go beyond, and we were talking a little bit about this on being a little bit more ambitious with endpoints. The US FDA just approved for multiple myeloma the utilization of minimal residual disease, for validation of drugs. This is a good step forward because minimal residual urothelial disease is a clear indication of efficacy, but it's also a potential surrogate for deep response and survival benefit. So those are the kind of, following the science endpoints that we need to have in our policy. And then a second example, that is the example of Germany, because that's also, country implementation. Germany has just released and voted the Medical Research Act. And in the Medical Research Act, for companies who include in their clinical trial 5% of German patients, you have a link between research and pricing and reimbursement policy, because for those trials for new drugs that have 5% German patients, you will have, I'm looking for a word, basically a pricing negotiation that will be some exemption, I was looking for the word exemption, of certain guardrails. So now by linking clinical research with pricing and reimbursement policy, I think Germany is making a step forward towards implementation.
I kind of wanted to return to the political discussion. So the person, obviously, who's going to be overseeing the continued rollout of the Beating Cancer Plan will almost certainly now be the Hungarian Commissioner-designate, Oliver Várhelyi. His fate, obviously, is in the hands of MEPs, such as yourself. And I was just wondering, based on his answers at his hearing a few weeks ago, and I know he was pushed certainly on smoking, which is one part of the Beating Cancer Plan. I'm just wondering how confident you, Nicholas, feel that he'll be the one to kind of introduce the measures that some of you have suggested need to be seen through.
I'm not very confident in the designated commissioner. I have to be honest. Hungary is not a good example in fighting against tobacco or fighting against cancer in general. So he's a Hungarian commissioner, but I'm confident in the European Commission. In the European Commission, people working there are very engaged with beating cancer, but of course, we are lagging behind in the tobacco prevention, for example. But let me say one thing that is very important to put the focus on that regarding the new commissioner and regarding the political moment that we are living, even in the USA. The next health secretary of USA is anti-vaccines. He denies science. We cannot buy the same political speech in Europe. To fight against cancer, we need research, development, and believe in science. So that's why my doubts about this political colleague of Donald Trump, that is Trump or Orban, and finally, Várhelyi commissioner. So we have to be very strong in the parliament, putting clear the lines, the tracks that we need in European health policy. We need vaccination for men and women regarding BPH to reduce and the phase out of this cancer. But we need probably new vaccines for new virus. We cannot have people denying vaccines, for example, deny science in the end. So it's also a responsibility not only for MEPs and people involved in politics, it's also for people that are voting. I have to remember this. It's very important to vote for people that believe in science. And this really didn't happen in the recent European elections.
Staying with the new commission, I kind of actually wanted to go back again and think about the announcement of the plan. And as I say, there was this big fanfare. It was very much at the centre of von der Leyen's first mandate. But I think if you look back at kind of the mission letters, the discussion of cancer in the hearings, it wasn't perhaps as present as it was during the first mandate. And now there's a lot of focus on things like cardiovascular health, on mental health strategy. So I'm just wondering, maybe to come to you, Wendy, do you feel like there's been any momentum lost at a political level on cancer, or do you think kind of just work's going on quietly behind the scenes in terms of implementing this plan?
I think if I can just, because you said it was going to be free-flowing, and just related to that question, what Pernilla said about funding, because I think the Europe Speeding Cancer Plan did release a lot of funding, and it authorized a lot of funding, and we're all very grateful for that. And that's why you see so many joint actions, you see so many projects. However, I want to say that the reason why, also another reason why is 6.5 for me, is I feel that the funding is really unbalanced and unfair. Yes, we can apply for funding, through operating grants and through projects, but if you look and see how it's distributed, it's really unfair. Very little for prevention. And I'll give you an example. For example, we are coordinating a project called Bumper, and it's a mobile app because part of the Europe Speeding Cancer Plan, it does mention cancer prevention, and I mentioned the European Code Against Cancer, increasing the knowledge up to 80% with the help of such as a mobile app. So the mobile app, we applied to coordinate this project, we got it. What we got for funding for 15 partners over 2 years is 1.8 million. So it's 1.8 million for 15 partners. And we are forced to work with the developers. So that's the tendering side. So that is a company. The company is developing the app, and we're providing the expertise, the cancer expertise, for them to develop the app. You know how much they're getting, the company? The budget for the tender for the company was 3.5 million for one company. You compare that to 1.8 million that we got for 15 partners as NGOs. It's completely unfair. And now it's going to be extended because the work hasn't been done, because it has to be coordinated with the European Code Against Cancer, the 5th version. And then if I can just also go back to another gap that I see in the implementation, or where it's going, is alcohol and nutrition. Labeling. We have the responsibility to make sure that consumers are aware, what it means if they're drinking alcohol, what it means if they're eating specific food. And one thing that was not addressed in the Europe Speeding Cancer Plan, and I would love for maybe the next edition or an addendum, is to address the commercial determinants of health. This is very important because this is what I feel is keeping us behind. Tobacco control legislation, alcohol, food, because all the industry, look at their, we're talking about budget. Their budget is, multiple folds than what we get. And, this is what we have to work with. If you, look and see about the directive, how that was done, and they totally try to undermine all the NGOs working in it. So, I kind of lost my train of thought, but I have a lot of things to say that there can be so many things that can be improved. And if we have Sanofi here, and I want to say also an important aspect is access to medicines, because if I can say that companies also fall in the commercial determinants of health, because yes, we need you. We need pharmaceutical companies to produce the medicine, but you're also a profit-making industry. So of course you have to make the profit and make sure that that's in line. So for us, the issue of the legislation, we need more transparency in pricing. We need more, and we're talking about equitable access. That's also part of it. And then just one last thing about MEPs, since we have MEP Casares here, is the MEPs, you guys have a huge role, to make sure that the implementation is going to go well. And I'm very glad to hear, what you just said about the commissioner designate, because I think you speak on behalf of all of us that, well, we're going to have to make the best of the situation, however it's going to be. So we provide the secretariat for a interest group called the MEPs Against Cancer, and that has just now been reconstituted, as you know, and they're going to be meeting beginning of December, and hopefully this is one of the things we're going to be talking about, how can we make good of a situation that is maybe not optimal, and we're going to need everyone's help in that. So, the MEPs Against Cancer, so it's been in existence for 15 years now. We provide the secretariat completely free of charge. We don't charge anything, but it's coming off the budget of the cancer leagues. So this is also going back to how unfair it is to the distribution of funding, and we would love to be able to have more funding. And then just MEPs Against Cancer, so still accepting new MEPs. Contact Tama at cancer.eu. She's also here in the audience. Thank you very much. That's my little advertisement.
Pernilla, I think you wanted to come in on that perhaps, but I also wanted to get a sense too of how things are working on a national level. I know this is something that you mentioned at the top about some of the inequalities there, and so I wanted to get a sense of kind of how different countries are delivering on the plan so far, and where maybe we are seeing those gaps in which countries, and what can maybe be done to improve those?
Well, I think at first, I mean, we have cultural barriers. People are looking differently to what cancer is and how to handle it in a way. Even though some governments are providing, tests and screening opportunities, etc., people they don't trust the system. So if we talk, the previous session here, talking about the future for healthcare, of course it's a huge problem if we don't have trust in healthcare. If you don't dare to go there, if you know that you will have probably will have some kind of cancer diagnosis, and so one woman told me that, oh my God, no, I will never go to mammography because if I do have breast cancer, then I know I must have treatment here in my country and I will never go there, I'd rather die. And if you have that kind of statements, I mean, people must understand that health and healthcare for citizens must be working all the time, 24/7. Either it is in war, in peace, in crisis. We have seen that during the pandemic. It needs to work. Either we have cancer or something else. We need to have a sustainable health care. And that's why I also think that some of the things we are talking about, like tobacco, alcohol, and so on, it's also, of course, crucial for other kind of diseases, and CDs of all kind, especially, of course, cardiovascular diseases. So I would really encourage also people to take the European Cancer Plan as a template for the other NCDs, not the least, because we need also to compare different diagnosis areas and to see where we can improve and go together to reach out to the different countries and say, hey, you must really, really look after your citizens and provide a good and sustainable healthcare, please, because otherwise if we decrease trust for politicians, for other kind of stakeholders and decision makers, that would really, really be bad for Europe for a long time ahead.
You mentioned using the Beating Cancer Plan as a kind of template for other measures. I know, this is kind of the first of its kind in the health sector, but I know the Commission, as I said, wants to bring out a cardiovascular plan. It's committed to doing that. There's also talk about mental health strategy. Perhaps, Antonella, how would you, do you think that this could work as a template in terms of, for the Commission to follow on cardiovascular or mental health strategy in terms of how countries are working together, how the Commission's managed it, or do you think there needs to be some tweaks for this to be seen as a kind of blueprint for other areas of health?
Well, first of all, I don't think that, so as patients, we are not competing. So cancer patients are not competing with cardiovascular patients. So this is very important to state. We are working together. For instance, prevention, as Gunilla mentioned, it's the same. So we can do the same research, the same policy strategies. So that is, we're perfectly aligned. In terms of template, yes. I must say that the Europe's Beating Cancer Plan is a very, very good plan. The way it was developed, I mean, if we all remember that the commissioner spoke with every single organization working in the sector. So there was a very, very good way of putting the plan on. There was also a very good attempt, I could say, in putting forward a monitoring system through the inequality registries. And this is also something very important. We always mention from the very beginning that only what is measured is done. So it was very important to identify clear indicators, and so also the fact that the European Commission called an external group, the OECD, to help monitoring the implementation of the indicators. So the way the plan was set up is can definitely be used as a template for other plans. Then with the implementation, then it's, so the effort was huge in Europe's Beating Cancer Plan. So I'm not saying that, I mean, I want to make it clear, the Europe's Beating Cancer Plan is an excellent tool. Then when it comes to the implementation, a lot of burdens came up.
Indeed.
The member states, because it's not easy. So it's the different roles between the European Commission and the member states are to consider when it comes to the implementation. And there I also see a role for MEPs, a stronger role when it comes to the implementation, because we see you as the bridge between Europe and the member states. So more can be done, I think, from your side to make sure that those kind of plans those health plans are implemented in the countries. And then, as we are promoting things, as the MEP Casares mentioned the importance of coordination. Coordination among member states is key, is very, very important. And so there is already a tool that facilitates the coordination among member states, and that's the European semester. So the European semester is already a tool. And why can't we implement health within the European semester? So some more indicators on health. Of course, now I would say let's start with a pilot on cancer. Why cancer? Because of Europe's Beating Cancer Plan, because there are already tools in place. So I think the European semester on health and on cancer could really help the further implementation of Europe's Beating Cancer Plan, and so that we could set a model for plan, but also for the implementation.
I know that it's sort of separate file, but still connected. Industry and researchers have really been pushing for the European health data space, more health sharing, and that data space was agreed quite recently towards the end of the close of the previous mandate, which will mean suddenly there's this opportunity for access to health data, and yeah, as I said, sharing. Obviously, as part of the political debate, there was lots of concerns around privacy and that kind of thing. But I wondered, from an industry side, how significant do you see that being in terms of research and innovation? When you think, and actually, when do you think we'll start seeing the benefits of that? Because that's something that I know, is still also in the implementation phase.
No, it's absolutely critical because working in healthcare is generating data in healthcare, and so you need to make the best in terms of utilization of these data. And at Sanofi, we're very focused on artificial intelligence, but trying to say, not to say artificial intelligence as a big bucket statement, right? Artificial intelligence can be generative AI, can be a large language model, can be machine learning, can be all those things that are going to allow us to use data for a reason. The reason can be stratification, identification of the right patients who will benefit from a treatment, high-risk patients who will benefit from a treatment, and that's going to be key also in early diagnosis. AI can help learn in the real world what is going to be the benefit long-term for patients of a certain intervention, of a sequence of intervention. So we need to use data with purpose. We need to use AI for exactly what it is, generating new content, analyzing, predicting. It needs to be very specific, otherwise it becomes a big bucket that is hard to really understand. And again, what we very often say at Sanofi is that AI plus human always beats AI. And that's something that we need to remember, and that really drives us in the way we use AI with the company.
One area, obviously, that has been, or it's been suggested that AI could help out with would be in terms of the health workforce crisis. And so I kind of wanted to come to you, Nico, not necessarily as an MEP, but as someone who worked as a nurse previously. And I wanted to get a sense of, like, what would you say would be like the major practical challenges for health systems when it comes to diagnosing, treating cancer? Is this something that you have experience of, or are there kind of gaps that are very obvious to you as someone who has that sort of practical experience or who's maybe worked in this field in the past?
First, let me say one thing. I am a nurse, but I am not in practice since 9 years, so I cannot forget everything. But my biggest concern regarding the practice, regarding the general practice, is that we are reducing nurses, we are reducing doctors in the health systems. There is a big challenge. It was mentioned before. We don't have enough nurses, we don't have enough doctors in our hospitals, in our primary care centers to give attention to all the people needed. So we had to increase the availability of nurses and the use of new technologies in order to give all the attention. Because if we want to go for better cancer screening, we are going to need a lot of massive use of nursing people working on that, making tests, collecting data, use the data, because don't forget, the data needs to be collected. It's not automatic. People say, okay, data is automatic. No. To find out how is a patient, you have to ask to the patient and then write. It's going to happen always. Or the blood pressure, you have not to write, could be direct, but you have to put the device on the people. No? So you always need people working on that. And it's very important to mention that we are doing mistakes in engage people to work in our national health systems. So we have to put more money on that in order to attract people in work on the health system, to be a nurse, to be a doctor. And allow me mention two things. The cross-links with the BECA. We need an assessment, of course, in the Parliament in the coming months or years about how the BECA report is implemented, first. Second, there are things very important for beating cancer. And one thing is the pharma legislation. We need a clear framework in the medicines and pharmaceutical products, very clear, that give the right balance in innovation and in accessibility and affordability of medicines, because we know there are a lot of shortages. There are a lot of medicines that are not sold everywhere in Europe. So we have shortage in Europe with medicines and with medicines used to treat cancer. And second, we have to go for a framework in these medicines, in the pharma packets, that could be used to foster research and development in new technologies as CAR-T, using all the power of the professionals, of the healthcare professionals in hospitals to develop new products. So I am a strong defender, for example, of the hospital exemption, the use of the hospital exemption, not everywhere and in every moment, but this singular use could help also to obtain new treatments at hospital level. So I think we have also an opportunity on that.
I think we're coming to the end of our time, so I don't know if each of you wanted to make kind of one final closing remark. You can see the minute counting down, so if we have like 20 seconds per person, something like this, yeah, just to kind of sum up the key messages, I suppose, that you'd like to say.
So the European Cancer Leagues, we're very happy that the Europe Speeding Cancer Plan exists, and we're very happy that it will continue to exist, but we would like to see more funding go into it, more fair distribution of the funding and implementation to put more, and what was not on the roadmap that we did not already achieve, and we're late, there have been delays, we would like to see that now taking into this now current legislature, such as the right to be forgotten. We don't want to see that dropped at all. That's very important. And for those of you who are not familiar with it, I think you can just search and see what has been going on with the Code of Conduct. So yes, we're optimistic, but cautiously optimistic.
Okay, thanks. Antonella, closing
Well, I
remark.
would just like to say that Europe's beating cancer plan needs to be, the work started needs to be completed, and I would really like to continue seeing the Europe's beating cancer plan high on the political agenda in Europe.
Nico?
Okay, I have another turn now.
A few, yeah,
Very
we've gone
few.
over, so very few, yeah.
Let's start working again on the beating cancer plan and assessments and foster all the ideas we have done.
Well, I believe in good leadership, and maybe we also need to take a new grip of the organizational challenges in healthcare. It's sometimes very, people are sensitive about, changing things in healthcare, but I do believe also we need to see that leadership and organization go together, and to have the Europe's Beating Cancer Plan implemented in the member states, it will also increase all healthcare, to my mind.
Thanks.
Well, I think it's really focusing on patient needs and innovation is a key thing, and that has been said across the panel. But also partnerships across public and private companies. Ecosystems is clearly important. I'll give you the example of France. Paris-Saclay Cancer Cluster is really a place where Sanofi is involved and where we partner with biotech, with academia, and with policymaker, very important. And maybe the last thing would be cross-pollination across member states, because there's implementation, but there's also good things to learn. Clinical trials in Spain, biomarkers testing in France, Medical Research Act in Germany. We need to all learn, from the good things that happen in the different member states.
Thank you, everyone. Thanks very much to our panel. Thank you for joining. Yeah, give them a round of applause. Thank you very much. And now, just for those of you here, to say that we have our lunch served, I think, in the networking area. And during the lunch break, you can participate in a standing yoga session in the main networking space. We're going to resume the stream at 2.
Thank you.
Thank you. Thank you.
We are united in diversity. We are very heterogeneous in our opinion.
If we do not renew our partnerships with the rest of the world, Europe will not be relevant.
We can make it if we are together as Europeans.
Do you genuinely believe that countries will manage to reach these very ambitious targets?